The latest on the new diagnosis for President Trump. The White House physician says that he has a chronic condition affecting the veins in his legs, and it is common among people of the president's age. Our chief medical correspondent, Dr. Narula, is here. So what is his diagnosis exactly, and what can it mean for other people who have it?
So his team is saying that he has chronic venous insufficiency, which we do see in a lot of individuals over the age of 50. It is very common. About 40% of Americans will develop this. And essentially what this means is the veins, as we get older, age. And so the valves in the veins weaken. The veins are used to kind of get the blood back up to the heart from our extremities and everywhere. So when those valves weaken, you can imagine the blood sort of pools. And so you can develop swelling, as was seen in the president. You could also develop varicose veins, heaviness, aching, throbbing in the legs. Sometimes skin changes, the skin can get discolored, or even ulcerations of the skin. The biggest thing when you see swelling in the legs is to really figure out why. And they really did a thorough investigation from the information they released. They looked for heart failure, which he did not have, kidney problems, liver problems, any underlying systemic diseases. They did ultrasounds of his legs. There was no clots, no problems with the arteries. And that's really what you want to kind of go through that checklist to make sure there's nothing serious. And then you're really left with this chronic venous insufficiency, which is not dangerous, not life-threatening.
Yeah, covering the White House, a lot of those photos causing a lot of alarm. People sort of zooming in, seeing the swelling of the legs. The White House didn't say how the president would be treated for this, but what is common treatment for something like this?
So usually the treatment is non-surgical. So it's going to be telling people to elevate their legs, to wear elastic sort of bandages or compression stockings. You also want to exercise. So the more that you walk or move, those calf muscles are going to squeeze and help push the blood back up. In more severe cases, you may use procedural therapy, so we call it sclerotherapy or ablation, where you actually cut off the veins and essentially prevent then blood from going down there and pooling and causing swelling.
So what are the actual risk factors here, and can anything be done to prevent this?
Well, really, there is a list, age being really at the top of it, but also being overweight or obese. We see it in people who are pregnant, people who smoke, who may be more inactive, who've had previous clots or injuries to the legs or veins in the legs. Those would be the things that predispose you to developing chronic venous insufficiency.
And we were showing some of the images there. What about the bruising to the president's hand? That's a separate issue, right?
That is a separate issue. So it is not uncommon to see bruises in people who are on aspirin. We know he's on aspirin. Aspirin's a blood thinner. Particularly when you get older, you lose the fat, you lose the collagen. Those capillaries, those very small blood vessels, can break and also be more prone to getting damaged if you bump or do something aggressive where you might be injuring those small blood vessels. The blood leaks out under the skin and you see the bruising. But I have a lot of patients on aspirin who say, I didn't even remember bumping myself, and they have bruises all over their arms. So not uncommon to see that.
We appreciate you breaking this all down for us, Dr. Narula. Thank you so much. We know a lot of people had a lot of questions about that.